I would like to begin by thanking everyone involved for their commitment and hard work in bringing this important event to South Louisiana. I would like to especially thank CADCA for their partnership with DEA 360 in making this event successful. The DEA 360 strategy is a comprehensive program that goes into communities hardest hit by opioid abuse. It is an approach to tackling the cycle of violence and addiction generated by the link between drug cartels, violent gangs, and the rising problem of prescription opioid and fentanyl abuse. While DEA's mission focuses primarily on the enforcement of federal drug laws and reducing the availability of illegal drugs, educating youth such as yourselves is a necessary and vital component of the overall strategy. One of the strongest weapons we at DEA have is teaching our young people the truth about the danger of drugs and about the criminal organizations that traffic the illegal narcotics that poison our communities. The Center for Disease Control and Prevention estimates that nearly 71,000 Americans lost their lives to drug overdoses in 2019. That's just under 200 people a day dying. While overdose deaths were already increasing prior to the coronavirus disease pandemic, the latest numbers suggest an acceleration of overdose deaths during the pandemic. The opioid epidemic, which includes the abuse of controlled prescription drugs, synthetic opioids, and heroin, has reached epidemic levels affecting large portions of the United States and has been declared a national public health emergency. Of those 71,000 overdoses I previously mentioned, about 70% of them were opioid related. That's almost 50,000 people, enough to fill up half of LSU's Tiger Stadium. Recently, DEA has been seizing fake prescription pills labeled to look like oxycodone, when in fact they were found to be fentanyl. When you buy drugs on the street, you don't know what's in them. The people that are making and selling these drugs don't care about your life. They don't care about you. They don't care about your family. All they do care about is making money. Today, opioid epidemic has claimed the lives of many people. Some of these unwittingly became addicts after taking medications prescribed by their doctors, and some never would have tried a street drug in their life. At DEA, we are working to educate those who prescribe these medications as well as their patients to prescribe and use them with caution. By educating you through these events, we will arm you with the information you need to make the right choices and change these alarming statistics I've told you about today. In previous years, we warned our youth that trying a drug such as heroin, cocaine, or methamphetamine, even one time could get you hooked. But today the stakes are even higher. You are playing Russian roulette with your life every time you use drugs. Drugs don't discriminate. They're an equal opportunity destroyer of lives and families. The fact of the matter is, you can't learn from bad decisions or correct your mistakes if you're dead. Ultimately, the choices you make can mean the difference between life and death. Remember, you can make a difference, and more importantly, you control your future. It is an honor to welcome you to this event, and I truly hope you enjoy the Youth Summit. Thank you.